Welcome back to Learn Nursing with Anila. Today we are going to learn about end of life care. Let's get started. The first one is definition. Definition of end of life care. The definition is end of life care is health care provided in the time leading up to a person's death encompassing care and support for mental, emotional, social, physical, spiritual, and practical needs. Once more, end of life care is health care provided in the time leading up to a person's death encompassing care and support for mental, emotional, social, physical, spiritual and practical needs. The next one is goals of end of life care. The main goals are enhance comfort and quality of life of patient and the family, ensure the pain and symptom management, emotional and psychological support, effective communication between patients, families and healthcare team, respect the patient's values, beliefs and cultural and religious considerations, and also offer the bereavement support. These are the main goals of end of life care. The next one is key components of end of life care. The first one is pain and symptom management. In this, the nurse should assess the pain of the patient using pain scales and also administer the medications as per the doctor's order. The other symptom managements are, if the patient has dyspnea, then we can go for oxygen therapy, opioids or positioning of the patient. In nausea and vomiting, we can use antiemetics as per the doctor's order and also have some dietary adjustments for the patient. In fatigue and weakness, we can ensure whether the patient is getting enough rest or not. Then also we can assist the patient in their activities. In anxiety and agitation, we can use some medications as per the doctor's order and should ensure the reassurance and calm environment for the patient. Now, the second key component is spiritual and cultural considerations. We should respect the diverse beliefs and practices of the patient and their families and collaborate with chaplains, priests or pujaris as per their need. Encourage the rituals and customs for their comfort, especially the comfort of their patient and also the family members. The next key component is communication and decision making. Open and honest communication is vital part of end of life care. In this, the nurse should use a clear and compassionate language with the patient and the relatives, and also discuss the advanced care planning and DNR orders, that is do not resuscitate orders. Then encourage the shared decision making with patient, family and healthcare team. Then education on what to expect at the final stages of patient's life. These are all about communication and decision making. The fourth point is psychosocial and emotional support. In this, the patient and family may often experience emotional distress. So, the nurse should ensure active listening and emotional presence while talking to the patient and their relatives. Then provide counseling or refer to some support services when required. Ensure and encourage the life review to promote peace in patients and family members' life. Support cultural and religious practices at the time of end of life care. The last key component, that is fifth one, is family and caregiver support. In this, the family plays crucial role in end of life care. So educate the family about the final stages of the patient and encourage the counseling for the family and also offer the bereavement resources. Next we are move on to signs of approaching death. Signs of approaching death. In this, the patient may experience decreased appetite and fluid intake, changes in respiration, that is chain stop respiration, cool extremities and motting of the skin, increased sleepiness or unresponsiveness. These are the common signs of the patient is approaching death. Ethical and legal considerations. The first one is advance directives, that is the legal documents already outlined about the patient's end of life. Then DNR orders, that is do not resuscitate orders, palliative sedations and ethical dilemmas. In ethical dilemmas, the nurse should advocate for patient-centered care and collaborate with ethics committees when needed. Now we are move on to phases of end of life care. There are 4 phases in end of life care. The first one is initial or stable phase. The second one is declining phase. Third one is terminal or actively dying phase. And the last one is after death or bereavement phase. In this, the first one is the initial phase or stable phase. In this, the patient has recognized the patient has a life-threatening illness, but the patient will be stable. They require symptom management and emotional support, and patient and family may begin with psychological and spiritual preparations. In the second one, that is declining phase, there is noticeable decline in health of the patient, that is physical changes will be there in patient. Example, pain will be there, fatigue and weakness will be there. In that, we need to give emotional and psychological support to the patient and the family, and also discuss about the preferred place of care. For this, we can see whether the patient may go to their home or any hospice care or in the hospital itself. That we need to discuss, and also increase the need for palliative interventions. The third one is terminal phase. In that, the patient is approaching death. The patient may die in hours or days. In this, they will show some common signs that will be decreased consciousness, irregular breathing, that is changed respiration, cold extremities and mottled skin. In that time, we need to focus is on comfort care like pain relief, hydration management, and emotional and spiritual support. Emotional and spiritual support you need to give. Okay, and then the family members are already prepared for the final moments. In the after death phase, the care extends to the family after the patient has passed away. In that, we are giving the support during the funeral arrangements, then grief counseling, bereavement resources and emotional supports. These all about the phases of end of life care. Thank you for your kind listening. If you like this video, let me know in the comment box. See you soon with another topic. Bye bye.